and welcome to our fourth video blog. This week I'm only going to do a short video rather than a written blog post and video. I have not yet received any feedback regarding last week's video blog, so if you are not finding the videos helpful or if you would much rather just have the written blog post, please let me know. I will not be offended. Okay, so for this week I have a short presentation and I'm going to cover two topics. So first, I'll do a short commentary on the piece that you read for this week, which is Ann Fausto Sterling's The Five Sexes Revisited. And second, I'm going to talk a little bit more about e-portfolios and specifically what is an artifact. Hopefully this will help you work through this week's assignment. So on to the five sexes. This is a recent photograph of Dr. Ann Fausto Sterling, who wrote the piece that you read, and who is a professor at Brown University. The piece that you read for this week is a follow-up to the original Five Sexes article published by Fausto Sterling in the Sciences Journal in 1993. I intentionally chose the sequel over the original since it was shorter, and also it offered more factual information on the biology of intersexuality, as well as details on more recent cases, which I think may be useful for our future discussions in this course. Also, in this follow-up to the original, Fausto Sterling shares with us some of her insights on the future of healthcare for intersex patients, which I think also provides us with fertile ground for our own thoughts on the matter. In that original piece, Fausto Sterling points out some of the social and political limitations of the two-sex scheme that operates in Western culture. She uses the example of Levi Sudam, an intersex person who lived in the mid-19th century, and whose ability to cast a vote in a political election was questioned due to his sexual ambiguity. This example illustrates two important points. First, that the existence of intersex individuals is certainly not something new, and second, that it raises social and ethical issues beyond the matter of how sex and gender shape our individual and social identities, which we read a little bit about in Iris Marion Young's piece. For intersex people, being assigned either at birth or later on in their lives to one or two sexes, male or female, has a very straightforward social consequence. For instance, this might determine who they will legally be able to marry, what clothing will be socially acceptable for them to wear, whether or not they will have to fulfill military service, for some countries at least, and what public spaces they will have access to. Not surprisingly, intersexed infants and children are subjected to surgical and medical interventions early on in their lives in order to ensure that they will fit into this established two-sex paradigm. From an ethical point of view, the argument for subjecting intersex individuals to these procedures is largely based on the ethical principle of beneficence, which, as used in biomedical ethics, refers to physicians' obligation to provide patients with a net benefit. In other words, the benefit of an intervention must outweigh the burdens. And here is a definition of beneficence according to Bernard Lowe. This is from the book Resolving Ethical Dilemmas, a Guide for Clinicians. But we can question whether or not this principle is being accurately used in the justification of interventions for intersex individuals. This because surgically fixing, I'm using air quotes here, intersex individuals does not necessarily result in their seamless transition to one of the socially accepted sexual categories, male and female. As Fausto Sterling points out, intersex has many manifestations, and although most of them involve some form of ambiguity of the external genitalia, these are, by far, seldom the only anatomical structures involved. Furthermore, beyond anatomy, the genetic makeup of these individuals often strays from the XXXY binary. In the original Five Sexes paper, Fausto Sterling states, "No classification scheme could more than suggest the variety of sexual anatomy encountered in clinical practice." And this is why in some places you might read that when Fausto Sterling originally wrote this paper, she wrote it kind of tongue-in-cheek. So this is the reason. She believes that there is no way to offer a scheme that would accurately reflect all of the possible combinations of genetics and anatomical structures that represent the full spectrum of sex and gender. In the original paper, the author also sheds light on the historical process that resulted in today's medical practices for the management and treatment of intersex patients. As she writes about some of the early scientific work on intersexuals, Fausto Sterling points at the transition from viewing intersex patients with mere scientific interest and curiosity, for example, the work of urologist Hugh H. Young, to an active and almost urgent desire to normalize these patients through medical intervention, for example, in the work of Christopher J. Dewhurst and Ronald R. Gordon. Here is, I thought I had a citation from Dewhurst's work. I don't in the presentation, but I will read it to you. Oh, here it is. All right, so this is from their work, The Intersexual Disorders, published in 1969, and it says, "One can only attempt to imagine the anguish of the parents, that a newborn should have a deformity," note the strong language, "affecting so fundamental an issue as the very sex of the child, is a tragic event which immediately conjures up visions of a hopeless psychological misfit, doomed to live always as a sexual freak in loneliness and frustration." So they certainly had a pretty gloomy outlook for people who were born intersexuals. This, however, we can see in other case studies and patients' opinions, is not always the case, and actually some might argue that it is rarely the case. So here we have another citation, and this is from the original Five Sexes article, but it's a quotation from Emma. We don't know if that is his or her real name, but this person was a patient of urologist Hugh H. Young. And so Emma was raised as a female, and she was born with both a vagina and a penis-sized clitoris. And although she eventually married a man, she continued to have and enjoy intimate relationships with women. So she enjoyed kind of these two phases of her sexuality. Emma had told Young, her urologist, of her wish to be a man, and Young suggested that he could help her medically and surgically to make that transition. But here on this slide is Emma's reply to that. "Would you have to remove that vagina? I don't know about that, because that's my meal ticket. If you did that, I would have to quit my husband and go to work. So I think I'll keep it and stay as I am. My husband supports me well, and even though I don't have any sexual pleasure with him, I do have lots with my girlfriends." So she was quite enjoying her life with her husband. It wasn't unpleasant. She didn't get any sexual pleasure, but she found it elsewhere. We don't know what her husband thought about this, but she was happy, apparently, as an intersexual individual. So to conclude my brief overview of the Fausto Sterling article, I encourage you to continue to think about the many questions that she raises, paying special attention to how professionals and perhaps policymakers and other stakeholders justify the need for medical intervention of intersex patients as well as the other side of the coin, which is intersex people's perspectives on their condition. Okay, now I will move on to the second topic, which is e-portfolios and specifically the use of artifacts. And to talk through this section, I am actually going to pull up a website which is from the University of Wisconsin-Madison, which offers us some illustrations of e-portfolios. So this is the website, and I will post this on our course webpage as well in case you want to explore it further, which I encourage you to do. So as portfolios and e-portfolios, as their use has extended beyond just the arts, so more and more people in different professions are using them, and so the kinds of e-portfolios have also become more varied. So in this particular classification that they make here on this webpage, we see that they mention personal e-portfolios, academic e-portfolios, and professional e-portfolios. For the effects of this course, I think that what we are trying to put together more closely resembles an academic e-portfolio, but it doesn't have to fit seamlessly into this category. You may certainly take elements from different kinds of portfolio to put your own work together. This is meant to be a creative project. So let's explore first this personal e-portfolio here, and I have the link open, so I'm just going to click on it. So this is an example of a personal e-portfolio, and obviously it's a fictional character. It's an e-portfolio for Bucky Badger, which I believe is University of Wisconsin-Madison's mascot. But what we're trying to look at here are the different parts of the portfolio. So this is the landing page or home page, and we see that there's a short introduction saying, who this person is, and then we have some images. And these images are what could be considered artifacts, conversation pieces. What from my point of view, is missing here is captions for these artifacts or pictures. So always with the use of artifacts, it's important to make a short note or include a short reflection stating what this image or this particular artifact means for the portfolio and for the owner of the portfolio. In this case, we also see that the site has subpages, and so it includes some essays, and since this is a personal e-portfolio, these could be just personal reflections, although it says here that they're apparently from courses, so an essay for English 101, an essay for comparative literature, and so on. We can also look at their example for an academic e-portfolio, which on the landing page goes directly to the academic work, so it offers us a list of essays. And again, here on the right-hand side column, I see a list of photographs, and in this case, at least they have a title, but there is no reflection to accompany them. So here, for example, the first photograph says Badger Volunteers. This is possibly an activity that the person or a group that the person has participated with. It would be nice if there was a short reflection beneath this picture stating how this person participated with the group, what it meant for their personal and professional development, and so on. Or it could just offer a short caption of what was going on in this picture. So was this a study session? Was this an advising session? What was going on? So always remember that no matter what artifacts you choose to upload to your page, and specifically for this week's assignment, you must include a short reflection, and that is of course included in the assignment description, so don't forget that. Your artifacts may be in fact essays, so an essay is a perfectly acceptable form of artifact. As long as you, again, provide an explanation for why you chose that particular piece of work and what it means in the context of the portfolio as a whole. Here is another example, and this one is supposed to be a professional e-portfolio. So a professional e-portfolio is something that you might use to go on the job market, for instance. So obviously it includes some different elements. One of the almost mandatory elements is a resume. You might also have a cover letter stating something like, in very broad terms, what kind of jobs you're looking for, and so on. It says here there's some multimedia, so if we click on that, it's mostly photographs. There are some videos down here at the bottom as well. Again, no reflections or captions on these, so that would be an improvement on how this e-portfolio is presented. Okay, so I hope that this brief walk through these 3 sites has given you some idea of what it is I'm looking for as far as artifacts. So again, an artifact, a conversation piece, a photograph, a video, an image, an essay, a poem. It can be anything. Be sure to look for something that is related in some way to the topic that we read about and talked about, or discussed in some way this week, and post a short reflection making that explicit connection. What does this artifact mean in the context of the discussion that we are currently having in the course? Okay, so with that, I think I'm just going to close and finish the video. So thank you for watching, and I will see you next week.